Talk Business Arkansas is brought to you by the Arkansas Farm Bureau, the Arkansas State Chamber of Commerce and Associated Industries of Arkansas, the Electric Cooperatives of Arkansas, Noble Strategies, the Arkansas Healthcare Association, and Delta Trust and Bank.
I'm Roby Brock. Welcome to this Talk Business Arkansas update, a recap of the biggest business and political news of the day. Plus, we interview newsmakers. Here's what are our top business headlines. Murphy Oil Corporation reported higher net income in the first quarter of 2013 of $360 million on lower revenue of $6.6 billion. 1 year ago, the El Dorado-based oil and gas company posted net income of $290 million in the first quarter on revenue of $6.9 billion. The company's downstream operations, which will be spinning off later this year into a separate company, showed improvement. When someone retires from Walmart after many years of serving the retail giant, they're leaving with a head and heart full of information, expertise, and wisdom. A growing number of Walmart executives who've left the store and the supplier community find a second career as speakers, writers, and consultants. Jamie Smith with our content partner, The City Wire, interviews several former Walmart executives and how they've parlayed their corporate experience into something new. You can check out the story on our website at talkbusinessarkansas.com. After this word from our sponsors, we'll take a look at our top political headlines of the day, and later I'll sit down with Bill Fontes. He's the general manager of the Little Rock Marriott, formerly the Peabody Hotel. What changes can we expect? We'll find out right after this.
I don't think it's going to be an easy conversation because they are very strong-willed. I think it's going to be important to us that we know that you're somewhere in a facility that looks after you, has compassion, has care, and you respect it. I mean, I'd love to look after them, I'd love to be able to take care of them, but I don't think I could. That'd be a wrong choice on my part.
Arkansas's skilled nursing and assisted living centers provide quality care for our seniors.
Farm Bureau helps protect its members in more ways than you might think. They've always been the voice of agriculture in Arkansas, working on behalf of folks like me when nobody else would. And Farm Bureau stands for the values that Arkansas families care about. They've protected my right to farm and make a living, which helps everybody who likes food on the table. You know what they say, Arkansas counts on agriculture, and agriculture counts on Farm Bureau.
The Arkansas State Chamber of Commerce and Associated Industries of Arkansas. The State Chamber AIA is the leading voice for business at the state capitol and serves as the primary business advocate on all issues affecting Arkansas employers. Our mission is to promote a pro-business, free enterprise agenda and prevent anti-business legislation, regulations, and rules. Now more than ever, business matters. Learn more at arkansasstatechamber.com.
Here's what's making the rounds in today's top political headlines. Attorney General Chief of Staff Blake Rutherford will be joining the McLarty Companies later this month as Vice President for Communications, Strategy, and Corporate Social Responsibility. Rutherford's been with the Arkansas Attorney General Dustin McDaniel since September of 2010. He previously served as Director of Public Communications for Stone Ward and as an attorney with Wright, Lindsay, and Jennings in Little Rock. With the McLarty Companies, Rutherford will report to Chairman Thomas F. Mack McLarty and Senior Vice President Franklin McLarty. In a letter to the co-chairs of the Joint Committee on Economic and Tax Policy, Arkansas Department of Finance and Administration Director Richard Weiss revealed today that the official general revenue forecast for the state is being revised upward. Weiss said that his agency is transferring a surplus of $145.6 million from the previous fiscal year, which ended June 30th of this past year. He also said that DF&A is forecasting a $113 million increase in revenue collections above current projections in the current fiscal year. And for the next fiscal year, he predicts an increase of $92.4 million in tax collections. The reason for the optimism? Improving economic conditions, albeit slow improvement. Of course, you can keep up with all of the latest business and political headlines each and every day on our website at talkbusinessarkansas.com. After this word from our sponsors, I'll sit down with Bill Fontes. He's the general manager of the Little Rock Marriott, formerly the Peabody Hotel. What changes can we expect? We'll find out right after this word from our sponsors.
Noble Strategies is a bipartisan state and federal government affairs firm with a successful track record of providing effective advocacy for business, government, and nonprofit entities. Noble Strategies provides service in areas such as lobbying, public affairs, trade association management, and marketing campaigns. Learn more at noblestrat.com.
I was looking for a bank that could best protect my finances.
That shared my passion for my business's potential.
A bank that offered investment expertise,
lending support, insurance guidance.
A bank that delivered full financial support.
That's how I found True Balance.
True Balance.
From my bank.
From my bank.
Delta Trust and Bank, the expertise to meet all your financial needs.
One of the real advantages of electric cooperatives membership is having a voice in our state's energy future.
Not a week goes by without important energy issues making headlines. These are issues that need to be discussed. And you should know that as policies are being developed, the cooperatives are looking out for our members, advocating what's best for you.
We are your friends and neighbors.
We are your local electric company.
The electric cooperatives.
We are Arkansas.
Joining me now is John Selig. He's the director of the Arkansas Department of Human Services. He was instrumental in making the private option a reality in this latest Arkansas legislative session. Thanks for being here.
Sure.
Let's talk about I want to know what the epiphany moment was when you guys discovered or decided the private option was going to be the route, the path to take, because there was a period of time in the early part of the session where you could clearly see there were some battle lines in the sand, and administration was wanting to do one thing, legislators were wanting to do something else. What turned the tide? When was that?
Well, I think it started when the idea first came out. I think it was Senator Dismang who said, couldn't some of these people be served through the private sector rather than being on the standard Medicaid program? Probably within just a few days, that turned into a discussion in the governor's office about, well, what if we ask if all of these people could be served through the private sector? And he said, I mean, we were all doubtful, but he said, I'll ask. And then when he met with the secretary, and she said yes, I think we all thought, okay, we've got a real chance here.
Was it a chance because it seemed to be more politically viable that was going to be the chance versus straight Medicaid, which was expansion, which was clearly going to have a tough time mustering enough votes?
That's exactly right. There were just too many people who had said, I'm opposed to the Affordable Care Act, to Obamacare, and really didn't feel like they could vote for something that was kind of standard Medicaid expansion. And there were just a number of people who feel like Medicaid is too big already and we ought to do more through the private sector.
You guys were generally very supportive of a lot of these changes and the experimentation that's going to go along with it. Does that present a challenge for your agency now? I mean, to kind of you're dealing with a whole new deck of cards.
Yeah, you know, it does, but I was talking with some of my staff today and talking about, you know, it is a challenge. It's going to take a lot of work, but if there's anything that's worth the effort, this is probably it. We're talking about doing something pretty helpful for about 250,000 people, most of whom are hardworking individuals but don't have health insurance.
Yeah, Randy Zook and I have talked just recently about the fact that a lot of these folks are basically working poor. They're not people on unemployed rolls right now. They're actually people that are employed, have jobs, so that's a big part of that. What's next in the process? You guys still have to get federal approval on this. Is that the next real formal obstacle to clear?
Well, the first thing we're working on is actually working with the insurance department to get good answers to questions that the insurance carriers have, because they're looking at whether to be part of the exchange. And if they're part of the exchange, they will also serve the clients that are funded with the Medicaid fund. So we've got 2 or 3 weeks to get that work done and make sure they know what it is they're bidding on, what the population is, for example. And then, as you said, we have to put together our proposal for what's called a Medicaid waiver, where in effect they're waiving some of the standard rules to allow us to do this private option.
What does I guess, do you anticipate, I mean, you guys were in communication with feds and a lot of this, particularly even the last minute negotiations that went on the day of that last vote in the state Senate. So you have to feel pretty good that they're going to give you the A-OK or the clearance to do this. But is it just a matter of the paperwork at this point?
It's the paperwork, and then, as people say, the devil's always in the details. They'll want some specific assurances probably. They'll want to know, okay, exactly how is this going to work? How's that going to work? We've actually got a team of people up in Washington today meeting with people from CMS about this initiative and just making sure that what we have in mind, what we've talked with them about, is consistent with what they have in mind, so that when we actually, as you say, submit the paperwork, there won't be any surprises.
So legislative communication will be important. I know one of the triggers in the bill was that that there would be some sort of reporting to the legislature so that they are in the loop on this, and I guess can ask questions and help shape some direction as well. How formal is that process? I mean, is it going to be spelled out very clearly? We're going to go once a month, or is it going to be a pretty informal process? You're going to call in some key legislators and give them a briefing?
It'll be some of both. I mean, there's some formal processes where when we have an amendment ready to go to our Medicaid plan, we bring it to the Public Health Committee and the Rules and Regs Committee and Legislative Council. So those processes are in place. But they've also made it clear, and we're interested in having informal discussions. As we've said to the public health chairs, whenever you as a group or individuals have questions, want to talk about things, have ideas, we're ready to talk about it. Just like with the federal government, we don't want any surprises for the legislature. We want them to feel comfortable that what we're doing in terms of the details is very consistent with the intent of that bill.
When we entered this legislative session, there was a revelation that the Medicaid funding gap that had existed prior to the session start had shrunk to around $61 million. Do you have any update on that today? Is it any smaller?
It's still looking good. We're actually now running the numbers from the third quarters, and I don't have those today, but our growth rate still seems to be in the 2 to 3% range, which is much better than what we had projected. And we're giving credit, at least in part, to the Payment Improvement Initiative we've talked about before. We're really trying to change the way we pay for care.
Do you have any other ideas of what else it could be besides the Payment Improvement Initiative? That was a subject of discussion at one committee meeting.
It could be a number of things, but that's the one thing we can point to that's different, say, from last year.
There were some other Medicaid reforms that went into place in this last legislative session to address the existing Medicaid program. One of those things that I guess came up towards the end of the session too is that you guys are going to enter a consulting contract with Emmerich Consulting. Tell me a little bit about that consulting contract and why that's a big deal.
Well, Tom Emmerich ran the benefits section for the health benefits for Walmart for a number of years, and he's really known as someone who can really help you. One, he can make a good connection between the private sector where he's worked and the public sector, because he's already worked with some public sector entities. But he also has really developed a specialty in working with what in the healthcare field you call outliers, people, those 5 or 10% of people who are the most expensive, who may cost you half your money because they have such complications. So he's really going to help us focus on those populations, help us look at our Payment Improvement Initiative and say, are there some things we could do differently there? So we think between that, and we have talked about for a couple of years now, not having a public sector healthcare system and a private sector, but really looking at Arkansas's healthcare system, because that's how you really make change. And for a doctor, they don't want the different pay sources to give them different directions on how to do care or what the incentives are going to be. He can really help us bridge that gap, which we've already started doing with some of the insurance companies, but really say, okay, how can you really work together so that this system is kind of seamless and not a bunch of silos?
What's the most, I guess, what are you most ginned up about, most excited about in terms of all of the changes that came out of this legislative session? It has a huge impact on your agency and your day-to-day job. Well, what are you most enthused about?
Well, it has to be this private option. And in part, it's going to help so many people that we serve in other ways. There are people who are getting nutrition benefits from us, people who, for example, have mental health needs. I mean, we've seen what's happened when people don't get good mental health services. Most adults don't have access to them because they're not eligible for Medicaid and they don't have private insurance. So I think for our mental health community, people who need behavioral health services, they'll get help very quickly, adults, and that will help all of us.
He is John Selig. He's the Director of the Department of Human Services for the state of Arkansas. Thanks for being here.
Sure. Thanks, Robbie.
We'll be back right after this.
Talk Business Arkansas is brought to you by the Arkansas Farm Bureau, the Arkansas State Chamber of Commerce and Associated Industries of Arkansas, the Electric Cooperatives of Arkansas, Noble Strategies, the Arkansas Healthcare Association, and Delta Trust and Bank.